Good afternoon. I'm Hae-Young Park, Acting Director of the Division of MCH Workforce Development. I'm joined by Cheryl Altus, a Project Officer in our division, as well as Michelle Tissue, Acting Deputy Director of the division, and several additional division staff this afternoon. Thank you for joining us for the Division New Grantee Orientation webinar. We're very excited to have the next hour together with you, and we are excited to welcome you to the Division of MCH Workforce Development family. During this new grantee orientation webinar, we will provide an overview of the Maternal and Child Health Bureau and our division specifically. We'll provide a closer look at the division, its programs, goals, and impact, introduce key resources to you, review information on grant administration and reporting, and also have time to answer any questions you may have. So a big welcome to our new grantees, those that are joining us as grantees for the first time, but also to those who successfully recompeted and are beginning a new 5-year grant cycle with us. You're now part of a national network committed to the development of the next generation of maternal and child health leaders, and we look forward to working with you over the next 5 years. This past year, fiscal year 18, we held grant competitions for 2 programs, the Developmental Behavioral Pediatrics Training Program and the MCH Nutrition Training Program. And we are excited with the expansion of both of these programs. Both programs grew by 2 grants. Now there are 12 MCHB-supported DBP programs and 8 MCHB-supported nutrition training programs, which expands the reach of both of these investments. We are also excited to award 8 new Healthy Tomorrows Partnership for Children program grants that support community-based programs to improve access to care for vulnerable and underserved populations. Now, a brief overview of the organizational structure within the Federal Department of Health and Human Services, which is led by Secretary Azar. The Health Resources and Services Administration, or HRSA, is one of the operating divisions within HHS. And the HRSA administrator, Dr. George Sagunas, joined us over a year ago, came from academia and has a very strong interest in training and workforce development and research initiatives. At the Maternal and Child Health Bureau, MCHB, Laura Kavanaugh is our acting associate administrator for maternal and child health, and having previously led the division of MCH Workforce Development, she is very knowledgeable about our programs and a strong partner and supporter. So HRSA is the primary federal agency for improving access to health care for people who are geographically isolated, economically, or medically vulnerable. HRSA works to achieve its mission through more than 90 programs that are awarded through grants and cooperative agreements to more than 3,000 awardees serving people living with HIV/AIDS, pregnant women, mothers, and their families, and people who are unable to access or have limited access to quality health care. HRSA also supports the training of health professionals, the distribution of providers to areas where they are needed most, and also supports improvements in health care delivery. As you may know, HRSA funds many of the programs that directly support America's healthcare safety net. The Maternal and Child Health Bureau, MCHB, is one of 5 bureaus within HRSA, and MCHB's mission is to improve the health of America's mothers, children, and families. MCHB works to achieve its mission to support optimal health and development across the lifespan by focusing on 5 program areas: maternal and women's health, perinatal infant health, child health, adolescent young adult health, and children with special health care needs. These areas together promote the physical, emotional, and social well-being across the life course. MCHB's research and data investments also advance the translation of research into practice and policy and provide data on key health indicators. And through our division of MCH Workforce Development, MCHB supports the development of future MCH professionals as well as support for the practicing MCH workforce. MCHB supports states and jurisdictions through the Title V Maternal and Child Health Block Grant. The Title V program seeks to create federal-state partnerships in all 59 states and jurisdictions to promote and improve the health and well-being of the nation's mothers, children, including children with special health care needs, and their families. The Title V program is the biggest federal lever for lifting up the MCH population and for driving improvement in maternal and child health in our nation. In addition to the MCH block grant, the Bureau also administers a portfolio of discretionary grant programs through the Title V Special Projects of Regional and National Significance, also referred to as SPRANs, as well as supports appropriated grant programs including autism, home visiting, and Healthy Start programs, to name a few listed on this slide. While MCHB is responsible for a wide variety of programs, we are united by a common mission to improve the health of America's mothers, children, and families. Let's turn now to the Division of MCH Workforce Development, one of 9 divisions and offices within MCHB. Our mission is to provide national leadership and direction in educating and training our nation's current and future leaders in maternal and child health. The division supports interdisciplinary graduate training and MCH workforce development programs, as well as an undergraduate pipeline training program. These programs assure that health professionals are trained in the unique needs of MCH populations. The division also administers the Healthy Tomorrows Partnership for Children program, which supports community-based partnerships and collaboration aimed at improving the health status of disadvantaged children, youth, and families by increasing their access to health services. While a number of federal programs invest in training and workforce, the division's MCH training program is the only program dedicated to advancing exemplary practice in the field of MCH. Across our program, special emphasis is placed on the core principles of workforce and leadership development, diversity and health equity, interdisciplinary, interprofessional training and practice, and advancing the field through new knowledge, innovation, and quality improvement. We also focus on the provision of care and development of systems that are interprofessional, family-centered, community-based, and culturally competent. Our division programs partner with national, state, and local organizations to develop and sustain MCH professionals prepared to provide leadership within Title V and other MCH programs. Our division administers approximately $51 million across 2 funding streams in fiscal year 2017. The 2 funding streams include the Title V Special Projects of Regional and National Significance, which includes our training investments in Healthy Tomorrows program, and then our second funding stream is the Autism CARES Act funding, which supports our autism workforce development programs. Cheryl will be providing more detail about the reach of our programs, but on this slide, as you can see, our programs have a national reach with programs in nearly every state and coverage nationally through partnerships. The division programs are categorized into 3 areas: interdisciplinary graduate training and 1 undergraduate pipeline program, MCH workforce development, and community-based programs. And while these programs support a broad array of specialties and disciplines, they are united under the MCH training program and united by the common vision. So the division's programs share core characteristics focused on training leaders in MCH, bringing diverse teams of interdisciplinary professionals to provide comprehensive coordinated care, promoting family leadership and partnership, promoting diversity in trainees, faculty, and the workforce that reflects the population served. And our programs have critical focus on collaboration with Title V and other MCH programs through a variety of activities, including technical assistance, training, continuing education, support of evaluation and needs assessment, that all promote the efforts of state Title V MCH programs to improve the health of the nation. So a little in terms of the data that we collect for our programs. In fiscal year 2015, which is the most recent year for which we have publicly available data, our division awarded over 150 grants, a $47 million investment. And across the 3 trainee categories, short-term, medium-term, and long-term trainees, our programs reached over 37,000 trainees, and nearly 300,000 MCH professionals were reached through continuing education. This also reflects the diversity of our trainees. A little bit under 26% of our trainees were from underrepresented racial groups, and a little bit over 9% of our trainees were Hispanic or Latino. So where are MCH trainees now? 5 years post-graduation, 88% of our graduates are leaders in MCH. 81% are working in an interdisciplinary manner to serve MCH populations, and 77% are working with underserved populations or vulnerable groups. So two of our key investments that support practicing professionals in the current workforce are the MCH Workforce Development Center and the MCH Navigator. And shown here are some data that reflect the impact of these investments. So I wanted to highlight several of those for you. The MCH Workforce Development Center is a key investment to support workforce development of Title V staff. And in 2016, as you can see here, participants reported a variety of achievements in their work with the center, which included 93% developed new skills for engaging in Title V transformation, 91% increased collaborative efforts across states and jurisdictions, and 87% increased their effectiveness as MCH leaders. And for the MCH Navigator, a learning portal for MCH professional students and others working in the field, we list here a variety of areas where they achieved great impact and reach across the MCH workforce and students and others working in the field of MCH. So we wanted to share with you our website. It's a very robust website that includes all of our programs, including your programs. We have a rich availability of resources on the website in addition to current activities, and we really welcome you and would like you to visit our website frequently as we make updates to it very frequently as well. And we're very excited and actually thrilled to release the 4th edition of the MCH Leadership Competencies, which was disseminated a month ago. First released in 2007, the MCH Leadership Competencies support current and future MCH leaders by defining the knowledge and skills necessary to lead in the field and unifying the field made up of a variety of disciplines. While much of the foundation remains the same, the 4th edition captures some updates, clarifications, and changes to support the growth of MCH professionals as the field adapts to our changing society. Now we are working with the MCH Navigator, a learning portal for MCH professional students and others in the field, to update the self-assessment tool and the corresponding resources and trainings. We'll also be updating our website with resources and tools for implementation. MCHB recently announced the launch of the MCHB Grand Challenges to support prize awards for development of low-cost, scalable, innovative solutions to pressing health issues. In 2015, MCHB launched its first America Competes Challenge with the Bridging the Word Gap Challenge, which fast-tracked the development of cutting-edge interventions to promote language development for children from low-income families. The current MCHB Grand Challenges includes 4 challenges in the following areas: preventing childhood obesity, care coordination for children with special health care needs, technology to increase access to care during pregnancy, and preventing opioids in pregnant women and new moms. Please visit our website for more information about these exciting opportunities. So listed here are a number of ways to stay connected with our division as well as with each other across our grant programs. We have a division training listserv. All new project directors are added to this listserv. You can also sign up, and other key personnel or others within your programs can also sign up for the division listserv by going to our website. On this listserv, we share resources and information throughout the year, including new funding opportunities, and disseminate information on key program efforts and activities. You will also come together each year for your program annual grantee meeting, an opportunity to engage with the other grantees in your program area and with your MCHB project officer and other division staff. We also have a division-wide grantee meeting which will allow grantees to come together across programs. Our trainee engagement efforts have grown tremendously and include a variety of opportunities and resources for trainees to stay connected with the division and with each other across all of the division's programs. You can help your trainees to get connected by sharing this information with them. The MCH Trainee Listserv is an opportunity to share a variety of opportunities, including MCHB internships, and training and research alert that goes out monthly, as well as announcements that come out from the Trainee Ambassador Group. The Trainee Ambassador Group, or TAG, fosters connections between trainees across the MCH training programs, provides trainees with leadership opportunities, and strengthens the link between trainees and MCHB. And just wanted to mention here that in the late summer, early fall, we will be recruiting current and former trainees to serve as trainee ambassadors for the 2019 TAG cohort, which serves from January through December of 2019. So please stay tuned for more information, and please help us to get the word out to your trainees. The other resources listed here, there are a number of trainee engagement activities, including MCH Connects, which is an initiative developed and managed by the TAG to facilitate connections between current and former trainees within and across our program so that they can engage in collaborative learning. And so it's another resource for trainees to keep connected with each other and with our division. And the Trainee LinkedIn, which is a relatively new resource, also that the TAG will be working on this year. And the goal of the group is to facilitate networking and collaboration among MCH trainees across the country. We also have a trainee toolkit, which is comprised of several resources for trainees, including a welcome letter, a welcome video for trainees of all of our MCH training programs, and a handbook to orient the trainees on the various training programs and highlight how our programs fit within the federal government and other related trainee resources. Now I will turn it over to Cheryl, who will go over some of the other data and reporting requirements.
Thank you, Hae-Young. Hi, everyone. I'm here to talk to you today about the reporting requirements as well as the new performance measure system and related resources that are available to you as grantees under our division. So after you receive your initial notice of award, the first major report due is a new competing performance report, which collects performance goals and objectives for each year of the grant. You will complete this report once at the beginning of your project period. It is due in the Electronic Handbook, or EHB, 120 days after the project start date. The next major report that will be due is the annual Non-Competing Continuation Progress Report, or NCC Progress Report. This is the first of 3 annual reports and is a narrative, qualitative report that looks at your progress in meeting your goals and objectives for the project year. The availability and exact due date of your NCC Progress Report depends on your project period, but it's generally in the spring for grants with a June, July, and September 1st start date. Your project officer will review your NCC Progress Reports, and this is the driver for a decision to continue funding your project for the next budget year. Once your NCC Progress Report is approved, another notice of award is released, and you will see a non-competing continuation NCC performance report in EHB. The NCC performance report is the second major report due annually, and it focuses on the quantitative performance measure data on your trainees and project activities. The performance report is due 120 days after the start of your new budget period. Now I'll go over more details about the performance reports on the next slide. The third annual report is your annual Federal Financial Status Report, or FFR, which is generally due in the fall after the completion of your budget period. If you have questions about your FFR, we encourage you to reach out to your grants management specialist, and I'll show you how to find their contact information in a couple of slides. In addition to your annual reports, you'll also have 2 end-of-project reports. The first is the project period end performance report, which collects data on performance data for the last year of the project period. And the last report is titled the Final Report, which collects information on program-specific goals and progress on strategies, including the impact of the overall project, the degree to which you receive the mission or achieve the mission, goal, and strategies outlined in the program, highlights on accomplishments and barriers encountered, and responses to some summary questions regarding your overall experiences over the entire project period. This report, as well as the project period end performance report, are due within 90 days from the end of the project period. Again, all of your required reports will be available in and submitted via EHB. We recommend that you check EHB for the due date for each report, and if you're a new grantee, make sure you are registered and create an account for EHB. If you have any questions, you can always reach out to your project officer. So in terms of the new performance reporting system, as many of you who are returning MCHB grantees will know, the Bureau has taken efforts to revamp all our performance measures over the last few years. And we launched a new performance measure and a new reporting system, otherwise known as the Discretionary Grant Information System, or DGIS, last fall. We encourage you to review the performance measures that have been assigned to your respective programs by clicking on the link on the slide. You can also refer back to your Notice of Funding Opportunity Announcement, or NOFO, where there was a list of performance measures. Technical assistance on the new performance measures and additional tools and other resources are also available at the link and also listed on the slide. Resources include archived technical assistance webinars, detail sheets which list the exact performance measures each program is responsible for reporting on, as well as form-specific tip sheets which help grantees answer some common questions about specific training forms. So for example, under training number 4, collaborative with Title V and other MCH-related programs, some of your more common questions that you encounter as you're collecting data along this area are addressed within the tip sheets. And like always, you can also reach out to your project officer and they will help you locate the information or respond to any questions. In terms of questions related to grant administration issues, you'll have to contact your grants management specialist, and you can find that information in the terms and conditions section of your notice of award. For questions regarding EHB, you can reach out to the HRSA Grants and EHB Contact Center. Their contact information is listed on the slide, and you can also submit your inquiries online through the link provided. And I think that's the end, and we can open up the lines for any questions.
Good afternoon. Your telephone lines were muted as you entered the room. If you hit *6 on your keypad, that will unmute your line if you care to ask a question verbally. Otherwise, you may use the Q&A pod that's in the lower left corner of the screen.
So while we wait for any questions to come in, we did have 2 questions submitted ahead of time, which I can go ahead and address. So the first question had to do with how program coordinators can best support the program and provide systems improvement. And so I think, we appreciate that the role of a program coordinator may look a little bit different at each program. We know they have a range of functions, including collecting performance measure data or helping to submit required reports in EHB. MCHB doesn't have a defined role for project coordinators or even require a project coordinator on the grant. So would encourage each program really to define the specific roles and responsibilities of a program coordinator. The second question that came in was around how do I organize my files so everyone knows where to put documents, what spreadsheets should we make. So in terms of file organization, again, I think that's a grant-specific issue that each program can determine. We do encourage you at the beginning of your grant to consider the types of information that will be required of you to submit to the Bureau each year. So as Cheryl Altus mentioned, taking a look at the required performance measures and forms to make sure you understand the level of detail that's needed in terms of information about your trainees, about faculty, and other activities. You can also reach out to your project officer if you've never submitted a non-competing progress report or narrative report before, and they can help provide some information on the level of detail and information you would need for that particular report. So again, would encourage you to, talk within your program about the sorts of filing and organization systems that work, but do know that, there's a standard set of information that's due to MCHB each year in the electronic handbook system. And if you have specific questions, please do reach out to your project officer. Those were the only two questions we received in advance. I'm not sure if we have any questions on the phone. It does not look like any have come in online, so we'll give everybody another second to submit any questions. Okay, well, hearing none, please do know that you are always welcome to reach out to your project officer or your grants management specialist at any point throughout the year for any questions. Thank you again for joining us today. We welcome you to the Division of MCH Workforce Development family, and a special thanks to Hae-Young and to Cheryl for their presentation today. We did want to remind you that an evaluation for this webinar will be emailed out to you, and so if you would take a second to answer that evaluation and help us improve future presentations, we would greatly appreciate that. So with that, we will sign off, and we will talk to you all soon. Take care. Bye-bye.